Thank you, Jonathan. And as usual, things are moving very fast. So when we submitted the Chief Executive report, lots of new things have happened. So what I'll do is give maybe an update on the more recent events, and then highlight the most important points that were listed in the Chief Executive's report. You already mentioned that we walked the Horton wards and the Ramsey. And you'll recall, Chair, that staff were very proud on Friday that they had no COVID patients being admitted to the hospital or in the hospital on Friday. And then over the weekend, we achieved another milestone with no COVID patients at all across the trust. And we've even today have no COVID patients. A word of caveat, we do expect some more COVID patients to come back into the hospital, but it shows that we have reached another milestone in the fight against the pandemic with a COVID-free hospital for the first time since we first admitted a patient. So I can tell you that when we met staff on Friday, they were very pleased with that at the Horton, but when Terry and I walked the John Radcliffe yesterday, a similar response was there. People are very relieved that we're entering a new phase into the pandemic response. Infection rates are also quite low in Oxfordshire and around. Of course, we all follow the news. There's still concerns about the variants, but we're in a much better place than when the last time we met as a board. So I think that is some positive news to start this meeting with. When board members will talk to staff, you'll notice that some staff are still pretty almost traumatized by the experience. This has been a very, very difficult period for many of us. And so Terry and I met some services where people literally were deployed to a different service on a day-by-day basis. They came in the morning and figured out via WhatsApp what service they would join that day. So fortunately, we're coming out of that difficult period, but we have to remind ourselves that this has been a very challenging period for many staff members. And we keep supporting them throughout this sort of period with health and well-being sessions, psychological support, to make sure that they can recover. And as we said last time, grow stronger out of this pretty traumatic experience for all of us. We were also happy to welcome Cqc Inspectors on May the 5th, after they had already interviewed our senior leaders and the infection prevention and control team before the unannounced visit. I briefed the board on the day on the verbal feedback that we had received from the Cqc Inspectors. But yesterday we received a letter, a very short letter, with some of the same content, but it does state that at the first opportunity we should discuss this letter at the public board. So hence I'm giving a verbal update of the letter, but we will of course receive a full report and be able to spend more time reviewing the report and making sure that we take all of the recommendations into consideration. If I can start with the positive news, which is in line with the verbal update that we shared on May the 5th. The inspectors observed very good hand hygiene and wearing of the personal protective equipment, the PPE. And I can confirm that. I mean, lots of us and other senior leaders have been doing walkarounds throughout the pandemic. And we're very pleased to see indeed that our staff is very careful, wears PPE, does the hand hygiene, the 7 steps are all followed. And it sort of amuses me when I walk around and there's a staff member that may have the mask slightly sort of at the borderline of the nose. They immediately sort of make sure that it's correctly positioned. So they're very much aware of this, and it's also good to see that the inspectors have confirmed that during their unannounced visit. Staff have told the inspectors that the IPC team, Infection Prevention Control Team, is very visible and very helpful. Those are the words in the letter. If I can add to that a sense of real gratitude to the expertise that that team brought during the past months, but also still now. The board will know that they were leading the way on staff testing. They were leading the way on sort of making sure that we had the right PPE equipment at the right time in every part of the trust. So we are extremely happy that we have such a strong team, and at least staff also confirmed that they were very visible and helpful to support them to keep safe during the pandemic. And also staff felt well supported with respect to the infection prevention by the senior leaders, which is good to see. That is people on this call, but also a lot of our divisional leadership and other senior leaders in the trust, which is good. So far, the positive feedback. Of course, when people come and inspect, there's also some improvement points. The first one that was listed was around the signage around the hospital, where the inspectors said it was not always very clear in helping patients, visitors, and staff navigate the hospital in a safe way. We do have the signs about the physical distancing and signs about the hand hygiene and the wearing of PPE, but it's more the signs on the floor, what direction you should travel, the one-way systems, and so that was the signage. Second point was around the cleaning schedules, which were not visible in the rooms that they inspected, and therefore they could not be assured that the cleaning frequency was as stated in our policy. And then finally, there were two remarks on sharp bins, which were in non-clinical areas, and they're not supposed to be there. They're only supposed to be in clinical areas. And also they noticed a lack of adequate storage space and observed that some boxes were actually therefore sitting on the floor, which again is an improvement area for the trust. So I think overall, we were very pleased with the positive points that were highlighted. I think it is quite good to see that an independent body sort of confirms what we felt all along, that we had sufficient PPE, sufficient support for staff to keep safe and keep our patients safe. And management is already acting upon the improvement points around storage and the signage and the cleaning schedules, which we will, of course, update the board in due course. So that's the CQC visit, and I thought of just giving the update during my chief executive's report. Moving to the report, a couple of highlights maybe to come to. First of all, we have some new estate in use that will help us with any subsequent waves in the pandemic. So level 5 at the John Radcliffe, the new respiratory unit has opened. And as the board will know, these are single rooms, well ventilated, which could be used by COVID patients or any other infectious diseases. In addition to, of course, the infectious disease unit, we have the John Waring ward. So this is additional capacity, well suited for infectious diseases such as COVID. And if you have been on the John Radcliffe site or followed me on Twitter yesterday, you'll have seen that the critical care building has now 3 levels already installed, 2 more to go. But we're on track to having a very beautiful estate in terms of critical care that again will be ready for any future surges that we may see in autumn or winter, if there would be further waves of COVID infections. We'll talk a bit later about the planning guidance that was submitted by NHS England and how we're responding. So I'm gonna not go into a lot of detail there because we'll have an update later in the board session. And the rest of the report again highlights some amazing achievements. It's gonna take too long to list them all in my verbal update, but the Horton again was a prize winner around the hip replacement. We had some fantastic studies being published by our researchers and clinicians around the impact of vaccinations, around testing, some new vaccine developments, not just for COVID, but for malaria. So a tremendous success in terms of scientific impact that's listed in the report, which is quite important because we're now submitting our next BRC bid for the next 5 years. And that is going to be quite important to be able to sustain the excellence in innovation, research and innovation that we have demonstrated in the past 5 years and certainly in the past year. Lots of residents in Oxfordshire, in the country and worldwide, have benefited from the investment that was made in our research capabilities. That concludes my update, Jonathan, but happy to take any questions.